Other businesses in Massachusetts, the governor announced today they can open their doors to more people beginning on Monday. Here to answer your questions about that and so much more, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Always good to see you, Doctor. We appreciate you being here every single week. This is big news for some businesses. They've so been struggling, restricted to 25% capacity since Christmas, but now everybody can increase 40% on Monday. Do you think, in your mind, the holiday surge is officially over based on this move?
I do. Hi, Maria. I do think that the holiday surge is likely over, but I'm worried about the next surge, which may be a Super Bowl surge. You know, depending what our behaviors are like, we may see more cases. As far as the reopening, I mean, I think, you know, the governor and his team are basing it on the fact that there's been decreased cases, decreased hospitalizations. I do think it makes sense. Most of these cases are not occurring in restaurants, in gyms. I just want to emphasize the key: masking whenever you're indoors as well.
And socially distance and hygiene as best you can, absolutely. But you bring up a great point. So let me ask you, though, do you think the risk of eating indoors or working out in a gym is significantly less now than it was a month ago?
Well, you know, when you look at like the sewage data that has been showing some decreasing, although sometimes you get some intermittent increases, overall the cases are down. I think the amount of virus in the community is less. But remember, we've got a lot more winter left. If we do the wrong things, if we take off our mask, if we don't physically distance, if we spend more times in crowds, we're just going to see, you know, another increase and create another epidemic loop.
Let's talk about the new variants of the virus. You've told us they may be more contagious. The CDC director is now saying that the UK variant may be more deadly. So what is the data showing right now?
Well, Maria, I do think that these variants are more contagious. They can enter the cell more. They can lead to more transmission. Are they more deadly? I think it's a little premature to say. Some observational studies from the UK say it may be a little bit more deadly. But think of the human body as a viral copy machine. Okay, and think of the variants as a copy machine that's copying on both sides. To stop the virus from spreading, you need to wear a mask and get your vaccine. To stop the virus from mutating, you need to wear your mask and get your vaccine.
And get the vaccine. So, Dr. Ellerin, more people are getting vaccinated every day, and we know that, and you've talked about it, it can be some side effects to it. You've mentioned the sore arm for an example. So is it okay for people, for example, to, I don't know, take an aspirin or an ibuprofen before or after the shot, or could it actually block the vaccine from doing what it's supposed to do?
Well, I think you're raising an important but unknown question. And I think the best thing to do right now is to not take Tylenol or these ibuprofens before the vaccine. If you have significant side effects afterwards, absolutely. In the clinical trials, close to 50% of people had to take something. But if you take it before, some studies, not with COVID, but with other vaccines, have shown a decreased immune response. So we want to try to avoid that.
Let me try to narrow down before. What do you mean before? An hour, a day, a week? What do you mean before?
Yeah, good question.
Right. I don't think you need to stop a week before, but I would say a day or two before.
Got it.
I would try not. Now, if you have a significant like autoimmune disease and you have to take these to prevent a disease, that's a different story.
Sure.
We're not telling people to change their regimen, but don't try to just preempt, say, I'm going to take this so I have less pain.
Got it.
I'd avoid that.
And really quickly, if you don't feel well, you've answered this before, but if you're not feeling well, you have cold-like symptoms, not COVID symptoms, cold-like symptoms, should you get the vaccine?
Right. So the answer is, if you feel like you have COVID-19, you don't want to go for the vaccine because you don't want to infect other people, obviously. But if you have very mild symptoms, remember, you're going to go in with a mask. I think it's reasonable to try to get the vaccine. We have to get more people vaccinated.
Dr. Ellerin, great to talk with you. Thank you. Have a wonderful weekend.
Thank you, Doctor.